Good day, everyone! I'm Camille Macanalo, your student nurse from Nueva Ecija University of Science and Technology, and I'm here to perform the assessment of 12 cranial nerves. And for the assessment, first check for doctor's order, the client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials. Then assess mental status or ability to participate in the procedure. And now for the planning. If possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. And now, prepare the equipments. These are wisp of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, or quinine flavors, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. And now, let's proceed to implementation. Introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary, and how the client can cooperate. Good day, ma'am. I'm Camille Macanalo, your student nurse from Nueva Ecija University of Science and Technology. May I know your name and your birthday?
My name is Rose Tindig. My birthday is May 9, 2001.
Can I see your wristband? So the procedure I will be doing is the assessment of cranial nerves so that we can know if you have any abnormalities. Ma'am, I will be touching some part of your body and you will follow some movements for the assessment. Is that okay, ma'am? Ma'am, do you have any question or clarification?
No.
Okay, ma'am. Let's start. Next is to perform hand hygiene and observe other appropriate infection control procedure, and then provide for client's privacy. Then inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, or any history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with smell, vision, taste, touch, or hearing. And for the assessment for cranial nerve number 1, the olfactory, ask the client to close their eyes and identify different mild aromas. Mom, first, I just want you to clean your nose. Now close your eyes and identify the scent that I will put in your nose and tell me what is it, okay? Mom, can you close your right nostril? Copy. The other side. Go. Very good. Next, the other side. Okay, the other side. Okay, good. For the cranial nerve number 2, optic, ask the client to read the Snellen chart. Ma'am, I want you to read that chart, the every line, and whenever you're ready, you can start to read.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D. I can read the other line.
Okay. Can you close the right side of your eye for me? And read again the chart.
E F P T O Z L P E D F E C F D. I can't read the other line.
Okay, the left side.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P E D. I can read the other line.
Okay. We can see that the client can read the line number 1 to 7 when her both eyes are open. However, when she closes her right eye, she only read line number 1 to 5. However, she doesn't recognize other letters. And when she closes her left eye, she can read the line number 1 to 7. And now, let's check the visual fields by confrontation. Ma'am, can you cover your right eye for me? And stare at my right eye. And tell me, how many fingers do you see? 2, 3. Okay, the other side. 1, 2. Okay. And for the cranial nerve number 3, which is the oculomotor, assess the perla or the pupil equal, round, reactive to light and accommodation, and pupil reaction. Let's turn off the light. Okay, constrict. Constrict. Now let's check the accommodation. Ma'am, I want you to stare on this pen. Okay, very good. And for the cranial nerve number 4 and 6, trochlear, assess 6 ocular movements. Ma'am, just stare on this pen and follow the direction. Okay? Very good. For the cranial nerve number 5, trigeminal, while the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. Now, can you look upward? Okay. And to test light sensation, have the client close their eyes and wipe a whisk of cotton over the client's forehead and paranasal sinuses. Ma'am, can you close your eyes? Can you feel it? Okay. And to test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. Mom, tell me if it's sharp or blunt, and tell me which part of your face is in it. Okay?
Sharpness on the forehead. Bluntness on the forehead. Sharpness on the left cheek. Bluntness on the left cheek. Sharpness on the right cheek. Bluntness on the right cheek.
Okay. For the cranial nerve number 7, facial, ask the client to smile, raise the eyebrows, frown, puff out cheeks, and close eyes tightly. Mom, can you smile? Raise your eyebrows, frown, puff out your cheeks, and close your eyes tightly. Very good. Now, ask the client to identify various places placed on the tip and side of the tongue. Mom, can you close your eyes and open your mouth? And identify what I will put in your tongue. Salt. Open your mouth.
Salt.
Open your mouth. Salt. Wash your mouth first. Next, tell me again what I will put in your mouth. Open your mouth. Lugar. Open your mouth. Lugar. Open your mouth again. Sugar. Very good. Open your mouth once again and identify the face. Lamansi. Once again.
Lamansi.
Once again.
Lamansi.
Nice. And for the cranial nerve number 8, auditory, assess the client's ability to hear the spoken word and the vibration of a tuning fork. Can you hear vibration
Yes.
in your both ears? Can you hear vibration? Can you hear vibration?
Yes.
Now I will occlude your right ear and say what I say.
Avocado.
face bone. Very good. For the cranial nerve number 9, glossopharyngeal, apply taste on the posterior tongue for the identification. Can you close your eyes and open your mouth and identify what will put in your tongue? Salt. Wash your mouth. Next one. Sugar. Last one. Okay. Now, ask the client to move their tongue from side to side and up and down. Ma'am, can you move your tongue side to side and up and down? Very good. For the cranial nerve number 10, vagus, assess with cranial nerve number 9. Assess the client's speech for hoarseness. Ma'am, can you open your mouth wide? And say ah. Now I will test your gag reflex. Now let's assess your ability to swallow. Drink this water. Once more. Okay. For the cranial nerve number 11, accessory, ask the client to shrug shoulders against resistance from your hands and turn head to the side against resistance from your hand. Repeat for the other side. Now, ma'am, I will put my hands on your shoulders and shrug your shoulders against my hand. Okay. The other side. Okay. For the last cranial nerve, number 12, hypoglossal, ask the client to protrude tongue at midline, then move it from side to side. Ma'am, can you protrude your tongue? And move it side to side. Okay. And for the evaluation, evaluate the patient's response to the procedure. And document the procedure and other important data on the client's chart.